Welcome to Colonie TV, the governmental educational channel for the town of Colonie.
Hi everyone, and welcome to Health and Wellness. My name is Paul Dreslow and I'll be your host. Today we're going to be talking about pediatrics, specifically pediatrics at different age ranges, things like antibiotics, breastfeeding, issues related to adolescents, and many other things actually. So today, to help us discuss these topics, we're very lucky to have two local pediatricians with us, Dr. Michael Looney of Delmar Pediatrics and Dr. VJ Gandham of Park Place Pediatrics. So welcome to you both, and thank you both for coming out and joining us today.
Thank you for having us.
Okay. Well, why don't we just delve right into things? We're basically going to be looking at the issues you might encounter with children, that parents might encounter with children at different age ranges. So we'll start with the youngest, the newborns and the infants, and younger children. So what do you both feel about breastfeeding versus formula? What are your stances, or what are your thoughts on that, Dr. Gandham?
Yeah, we love breastfeeding. We're very happy to encourage the moms, whichever way we can, to really enforce the breastfeeding, make a big difference in the child's health and the bonding with the mother. I can't say enough about it. It's awesome.
No downside or anything? Or?
No downside. Okay. No, none at all. No.
Okay, very good. Dr. Looney?
Yes, breastfeeding is the best. There's no question about that. If you look at what's in breast milk as compared to formula, there's no question. The formula companies spend millions of dollars trying to get their formula to be just like breast milk. We advocate, there's so many positives for that. The only thing I would like to mention is that sometimes some moms can't nurse and some babies can't breastfeed.
That's true.
And there are medical issues for that. And Doctor covered everything pretty well. I just wanted to mention that one aspect because I don't want my moms to feel guilty because their baby was premature and they can't nurse as well with that. Or they're sick and they're on antibiotics, or they have to take certain medications so they can't nurse. Then I kind of worry that, oh my gosh, they feel like they're not going to be good mothers because they're not breastfeeding.
That's true.
So all things being equal, breastfeeding is the best.
Okay. What about if you have problems with getting babies to fall asleep? Is there any particular method that you should do or not? Just let the child fall asleep on their own? Is there anything you can do about that?
The newborn period?
In the newborn period, yeah.
Yeah, we kind of let the babies and the moms go with the natural rhythm of the baby, especially in the newborn period. We don't let them oversleep. We tell the mothers don't let them go more than 4 hours, because that also gives us an idea about any kind of problems that they may be having at home.
Yep.
And then after the newborn period and after their weight gain's pretty regular, we help them depending on what's going on with the family. If the mom has a toddler, if mom's going to work, and so there's not a blanket statement for everybody on how to soothe the parent and the child together. But reduce stress as much as possible for both the family and the baby, and the S's that we all tell the parents about, the shushes and the swaddling and the rocking and comfort mechanisms. But it's an very individualized thing. Yeah, case by case, yes.
In the beginning point in time, mothers are exhausted because if they're nursing every 2 or 3 hours, and they're happy if anybody falls asleep for a period of time. Once you get through that period and you're moving on, one thing I do tell mothers is it's a good idea to try to get your baby to fall asleep on their own. I find that's a really difficult thing for moms. If their baby cries or they wake up, the first thing they want to do is feed the baby. And baby sleep cycle is about 3 or 4 hours long. So every 3 or 4 hours, your baby wakes up during the night, and if everything's the same as when they first went to sleep, they fall asleep again, and they do fine through the rest of the night. So the moms that play music, dance, sing, have snacks, watch TV, nurse the baby, and then they get the baby fast asleep while they're walking with them, those babies typically wake up through the night much more calmly than other babies do.
That's true.
Okay, somewhat related to that, what about co-sleeping? Parents who sleep with their children when they're very, very young, infants we're talking about here. How do you both feel about that?
Can I go first on that one?
You can go first if you want.
Okay. If you look at the SIDS incidence, now SIDS has dropped dramatically in the United States because of the policy of having babies sleep on their backs. But unfortunately, if you look at the data, the incidence of sudden unexpected infant death has not continued to drop. Sudden unexpected infant death has cardiac, respiratory, infectious, and also other. And one of the components of other is suffocation. And many people now, when they look at some of the old SIDS deaths, those are actually suffocation deaths, not strictly SIDS deaths. And co-sleeping, if you look at the videos, we look to see how quickly it happens, is co-sleeping, especially new babies, we don't advocate that. That's a very dangerous thing. I take issue with the fact of saying safe co-sleeping for those particular babies. There's no data that says that's safe. And I have trouble when a mother tells me, well, I'm the kind of mother that would wake up if my baby's having a problem. Because my issue with that is, are you telling me that these other poor moms who slept with their baby and whose baby suffocated, they were bad moms? That somehow they didn't have a signal that they woke up? So with newborns, co-sleeping is not felt to be a safe issue.
Yes,
Gandham?
yeah, I totally agree with the very newborn. It is not safe, as you mentioned. Mothers
Right.
are exhausted, and it's impossible to know what's going on. But nowadays they have those little cribs that you could attach if they want to be in the same room in the bed,
Right.
but they're
Separate.
separated, and they're
Yeah.
safe. Yeah, I totally agree with that.
And just on a sidelight issue with it, as the kid gets older, it's been my experience when a kid sleeps in the parent's bed, the kid sleeps perpendicular. And the parents wave to each other from across the sides of the bed because the kid is sleeping sideways between the two parents. I don't know if you've had experience, but that's been my experience with parents like that.
Yes. And research has shown that we all actually sleep better individually in our own beds.
Area.
Yeah,
Yeah.
and
Okay.
deep sleep is much
Can I
better.
go back to the breastfeeding question for
Feel
a second?
free.
Okay. Another issue that we didn't touch on is the use of pacifiers. Okay, and for a long period of time, one of the longest running urban myths we had was that pacifiers confuse babies and pacifiers are detrimental to nursing. And there's no good study that shows that that's the case. And in fact, the most recent studies show that pacifiers actually decrease SIDS. And the best example is two things. One is the American Academy of Pediatrics in 2014. Their statement was that pacifier use with the best available medical evidence shows no deleterious effect on breastfeeding. The other one is, if you look at the West Coast, and they had a big to-do about breastfeeding in the hospital, and they took all their pacifiers out of the hospital so their moms would only nurse. At the time they did this, they had an 80% breastfeeding rate in the hospital. They took all their pacifiers out and locked them up. What happened to the breastfeeding rate? The breastfeeding rate dropped down from 80% to 65%. So I think people can feel a little bit more relaxed about the fact using pacifiers is not going to be a big problem with their babies.
I totally recommend it. I actually encourage the newborns to use it. I believe it's part of oral gratification to help them feel comfortable, feel safe, and it also, I tell the
Right.
parents, it develops their cheek muscles, their sucking rhythm, and we try to encourage, and they all get afraid about it. The parents get afraid about the nipple confusion, about the addiction, and we tell them, we start removing it towards 6 months, you know, as the
Right.
baby's a little more comfortable, you know.
The other thing we look at is, I think we both agree that babies can be a little more intelligent than we sometimes give them credit for. And if I have a baby that's nursing and getting breast milk and be close to the mom, and I have a baby that's sucking on a pacifier and nothing is happening, I give my babies a little more credit in knowing there's a difference between those two things. And they can tell the difference between nursing and pacifiers with that.
So true.
Okay. What about vaccinations? You start vaccinating at certain age ranges. This is where you typically would start, I'm assuming. So how do you both feel about that?
Yeah, we both 100%.
we talked a little
We
bit.
talked
Okay.
before we started.
This one, either one of us could start and talk.
Yes,
We're
yes,
both 100% agreement on this one.
100%, yes.
Okay. No-brainer.
Yes.
But I think we should bring it up because both of us agree 100% on vaccinations, but not everyone in the United States does. And it's really one of the best healthcare gifts you can give your child if you immunize your child. They've been around for a long, long period of time. If you look at the data, there's at least 700,000 cases of these diseases that are prevented by the use of immunizations. National Geographic had a story that I felt, I was teary-eyed every time I looked at it. And it was a father holding his daughter. And the father said, "My daughter will never walk." And what happened was the World Health Organization came through and they were going to vaccinate everybody for polio. And the people in the village said, "No, we're not going to vaccinate because the CIA is involved, because it sterilizes the women." They did not vaccinate their children in the village. And 3 months later, polio went through the village. And now you have these kids that will never, ever walk. And this was 100% preventable. The outbreaks of disease in the United States now, they're always, at least as far as I know, associated with some group or individual from another country who came in that wasn't fully vaccinated.
No, so true. It's devastating. I think people don't realize how these vaccines kill. Or if a parent asks us, "Can we wait?" And it's like,
Diseases
hey,
kill.
Yeah, diseases kill. Oh, did I say what did I say?
Said vaccines.
Oh no, diseases kill. These vaccines prevent all of this, and parents want to wait. And it's like playing Russian roulette. It's sending that baby out into the world without vaccination on time.
Right.
On time.
If you look at the fact of autism, we've had more strides now in research into the etiology of autism in the last few years since we've gotten away from this so-called MMR causing autism strain. That was a totally fabricated study, and it's my feeling that the people behind that study should actually be in prison for murder because of what they did for the kids that were not vaccinated and died because of the erroneous information these people put together.
Very sad.
Any particular, like, when do you start? What do you mean? It's like how
You start at birth.
right up immediately, like
In birth, right, in the hospital.
There's certain vaccines that can be given at birth.
right away. Okay. All right. So let's talk about is there any particular books that you recommend for parents when they're just starting out? I know they probably come in with the internet now. They basically have a lot of information on their own. But is there anything in particular that you might recommend to a new parent? Any particular book that's caught your eye?
The one that the American Academy of Pediatrics puts out, that's the one that we usually
You recommend?
Yeah.
It's a great book. The one I tell parents not to get is The First 12 Months of Life.
Okay.
So don't get that book because it lists every possible thing a baby can do over the first 12 months. And I always get parents coming and saying, my baby's not doing this. Excuse me? My baby's not doing this. It says in the book. Should we do it? So that's one book I said because sometimes it gets parents nervous.
Right.
Penelope Leach is a good one. T. Barry Brazelton is a very good author. And he is a very, very good one for parents to read because he talks about how children develop, how they become persons, things they do. So he's a very, very reinforcing one for parents to read.
Okay. All right, moving on, let's move on to a little bit older children, but some of these issues will apply to any child, actually. Antibiotics, when you're looking at slightly older children and they start having a need, through cuts or whatever, how do you feel about antibiotics?
We try to educate the parent, about fever, being afraid of fevers, being afraid of cuts and insect bites, and now Lyme disease and tick bites. And so, appropriate use of antibiotics. We're cautious about it, but there is a place for antibiotics. And I think the key there is educating the parent for when there is the need for it.
You mentioned Lyme disease, actually. I understand it's been a little bit of an uptick recently in Lyme disease cases, or there's going to be because of the type of winter that we have. Have you seen anything related to that?
We're getting a lot of tick bites questions throughout our offices.
A lot of it, I believe, has to do with deer. That the deer carry the ticks all over. So because we have such a deer population now, just walking through people's backyards in urbia and suburbia, that you have a lot more ticks than we did beforehand. Just jumping back to the antibiotic question, I agree 100%. We don't use antibiotics like salt and pepper. We use appropriate antibiotics for disease if we think they're needed, and we don't bow to someone who says, "Oh, I want that 3-day antibiotic to take," because that's quicker. Okay? Because it really depends on the particular disease what you're going to use or not.
Okay. All right. What about overweight children or obesity? It's definitely gotten that problems associated with that. We know what they are, and there's a lot. It's become more of a problem over the past 10, 20 years. So how do you work with that? How do you to get children to deal with it, parents to deal with it? How do you? What are your thoughts on it?
It's a very important topic, and try to involve the whole family as a unit, not to single out the child that, oh, you're fat or you're overweight or problems with that, and to focus as a family unit to eat healthier. And I try to focus, well, this is important for your heart and this is important for your brain, instead of the physical image of it, because they're so sensitive, especially our girls. They get very emotional, so we be careful with the wordings that we use. And again, educating them, printing out lists, whatever, nowadays the kids have their phones, and there's certain healthy apps that we could direct them to. It's a whole family affair. I really believe that.
Not isolating a child, make family level changes in activities and
water, and there's a whole lot of education that needs to be done.
It's very difficult to tell a child they're overweight when the mother is 250, the father is 375, and there's two siblings who are each 280. So it's really a bigger issue. It's a family. The other thing you want to look at too is why. What's going on? Well, this is the girl that's been picked on by everybody at school. So what I do is I come home and I eat. That's my best thing. Okay? So you really have to look at that in terms of the whole family, exactly like you said, and then are there individual issues leading up to that? And then are there simple things you can do? For example, a bottle of Coca-Cola or a bottle of regular Gatorade, about every 2 weeks, that's a pound of weight. So you substitute a bottle of water for a bottle of soda or a bottle of Gatorade, that's a pound every 2 weeks. That's 25 pounds a year just from that.
Right.
Yeah. They need a lot of support with that. It's ongoing. It's not
That's a tough one.
Not a one time you see them for your physicals. I tell parents that. We need ongoing communication with this.
Is it more like what Dr. Looney said, is the family's basically overweight, or is it more typically one in particular individual, or is it?
If percentage-wise, I think most of the time it's the whole family unit, and then we of course do see the families, and sometimes you have the opposite. You have one sibling that's on the extreme end, underweight, and you have the other one that's overweight. The poor mothers are struggling with that, so it is hard. And we do see anorexics too. It's a battle. It shouldn't be, but it is. It is.
It's also difficult because there are not a lot of resources available. Like I can refer someone to a cardiologist, I can refer to a pulmonologist, refer to an allergist, but there's not as many resources for kids who are either grossly overweight or kids that are anorexic. Right. It's a tough battle to get in to see them.
Okay. Moving on, slightly older children, let's talk about adolescents. Generally about pre-adolescents and adolescents, 10 to about 18. We'll try to cover all of them. How do you address problems that come up related to like sex, drugs, alcohol type questions with older teens? Like how do you, when people come to your office with children who have these type of problems, like how do you deal with any of those topics, any of those three topics?
I think majority of us use checklists, questionnaires before they come to us too. And I use that as my template to help them, to discuss. I said, I know there's a lot of personal questions on here, and the reason these questions are here is because we as your doctors are not just worried about your physical health, we worry about social health, we worry about what your mind is thinking, so I do address each and every one of them. I do open it up and I tell them, this is the best place, it's a safe environment for you to talk about these things, and to give them the confidence that this is really, really important to talk about. And these things do happen. I tell them, just because you live in our safe community here, that doesn't mean that you can't be exposed to AIDS. It's not something that you're going to see in New York City and things like that, because they feel invisible. They feel like these diseases aren't going to come to me.
Do you normally, when you have this conversation, is it just with the child or is a parent involved too? Like how do you go about that?
I tell some of the parents, we start at 13, and some of them get very upset that we're talking about these things. And I tell them, this is something that we do as a policy across all of them. It's not because of your child. It's important to educate. It's important. Your child will come to you if they have problems if we start talking about it in a safe way. So I tell them, we're going to be talking alone about this, and then we're going to bring you into it. But these are topics that we will be talking about. And some of them get upset. And so I have a few that tell me they don't want me to. But I tell them it's for their health.
You also look at it that you have some kids that are using, and you have kids that you're bringing it up because you want to educate them, but you also want to reinforce on the kids that are not using drugs that that's a good choice.
Right.
You did a good job with that. That's very positive.
Right.
So we talk about all these things. When I talk to the kids, a lot of times, everything now is electronic. So I have my hands off the keyboard. So they know I'm not writing it into the chart. Oh yeah, and you smoked how much last weekend? Okay, and you picked it up where? And, you know, so because we want them to feel that they can talk to us about things,
Right.
and there are health issues associated with these things that need to be addressed, whether the parents are aware of some of these or not, unfortunately.
And it's the same type of situation. You kind of have the discussion with the child first, and then bring in the parent.
It depends. Sometimes the parent's not brought in. There are certain issues that by law you are not allowed to discuss with the parent if you discuss them with the child, and the child does not wish to discuss it with the parent.
Okay.
So there, it's not just like, oh, they walk in, what'd you talk about? Oh, you know, we were tying shoes and, you know, we were shooting hoops, because they have certain issues. And the parent will bring up one thing, it'll be totally different than what the child is talking about.
Yeah.
I can't say how many headaches I see.
Yeah.
Okay?
That's
Right?
true.
And then you come in, but it's a different thing. But you're stuck because the kid knows, if the kid says, yes, I had unprotected sex these 6 times, the parent may not understand that as well, and may not be ready to deal with that at this point. So you always talk to the kids about being open with the parents. But if you look at it, the CDC recommendations, the health department recommendations, the American Academy of Pediatric recommendations are all that you treat these kids, whether or not you have parental consent for that.
Right. Right.
And we tell the children that too, that, you know, if you don't want us to, we won't tell the parents. We can't by law.
Right. I tell them it's
They're
a black box.
protected. Yeah,
Okay.
they're protected.
Is there an age where that cutoff is between, or is it just, or is it anyone basically at any age?
Well, there's a law.
If the child doesn't want you to,
There's a law that says, I
Anything.
believe it's like age 10, there's certain things you cannot discuss if the child brings it up with that, and some of them have to do with sexual activity.
Right.
And other ones are just even in routine cases, they come up in ear infection or a cough or cold. That's up to our legislature friends. They take care of that aspect and force it on us. I mean, no, I'm sorry. Yes.
All right. Now to some more general questions that would apply to any child that you're dealing with. How long do you typically spend with each patient that normally comes into your office, or any type of an issue? How much time do you have to dedicate to each child's case?
well, because we've been practicing for a while, our staff kind of knows which families we're going to be taking longer time and which ones are quick. And so
Right.
I think the office is set up that we could tell the parent, look, this is going to take a little bit longer. Let me go see a couple of these other kids and come back to you. But we're scheduled for half hours for physicals and 15 minutes for sick. But that doesn't mean that that's what's going to be happening. But that's how our schedule
Starts
run.
off. Okay.
I tell people that we're not a bank. And there's 2 kinds of time. There's Kairos and there's Chronos. And Chronos is straight clock time. So you have an appointment at 2 o'clock, you're seeing at 2 o'clock, the next appointment is 2:15, they're seeing at 2:50, it goes on. But pediatrics is not the case. Because pediatrics, someone walks in the door, my parents are getting divorced. Okay? My cat just died. Your 15 minutes are up, Billy.
Yeah.
Yes.
See you later, go out. So it's different. Or someone just fell off the side of the table and they've got a laceration in the forehead, they just walked in the door. So pediatrics is different. We're not exactly as straight, you know, unfortunately they tell us we're supposed to be, but pediatrics works differently than other specialties in that regard.
Right.
So we have to have a different time issue with that than they do.
Okay.
Or our asthmatics stay a little longer with, you know, nebulizers and stuff like that. We're trying to keep them out of the hospital.
Right,
So we have
right.
certain area we'll just observe them for a while. Or fevers, you know.
And it would be nice if you could just say, yep, okay, 2:15 you're here, 2:30 you're out the door, see you later, yep, oh, just a family.
Does,
But
yes.
that's not, that works to be all. Or the mother has 2 kids with her, and Jimmy's crying the whole time. She goes, Dr. Looney, could you just take a look at his ears? Dr. Says, no, she's got this thing on her toe, you know.
What are you
You
going to
know,
say?
but see, we deal with families.
Right.
We deal with things very differently than other pediatricians are very, very different than other practitioners.
Right. All right. Do you ever ask parents or advise parents of parenting methods or anything that they should be doing with their child to prevent problems? Do you ever think that's something you kind of stay away from? Like, how do you think about
All
what
the
you do?
time we do
Yeah,
that. We do that all the
the
time.
majority of our practice is prevention.
Right. What you do is you always have to, because we're not just dealing with this one individual. We're dealing with the whole family. So we're dealing with every one of those questions every time when time goes on. I mean, we're dealing with, Even some things as like social media now.
Yes.
Okay?
Yeah.
Like a lot of kids away from Facebook. Now they do this Snapchat and Instagram. And, you know, I'm an old guy. I don't know all this stuff. But I do know that these things are supposed to go away in 10 seconds. Right? Oh, so I say, oh, so it goes away. So it's safe, right? And they say, oh, yes, Dr. It's really safe. It goes away in 10 seconds. I say, have you ever heard of a screenshot? Oh, yeah. So nothing is safe. So those are the kind of things we educate with some of these older kids. Too much, too soon with a lot of these kids.
Right.
They're getting too much of it. So you go over with the parents. You always want to tell the parents preventive things. You're talking drugs, alcohol, good exercise, eating, sleeping, activities. You know, not just playing video games on the sofa or with your PC. Those are all important to go on. Then you look at, okay, this kid's doing fabulous. He's got good friends. He's got good grades. He's happy. I'm pretty much set with that. That's pretty good. Whereas someone else, gee, the grades just dropped down now. He was an honor student. Now he's failing 3 courses. Used to be a star athlete. Now he doesn't play anything anymore. There's something going on there.
Right. You ever run into any parents that feel like you're overstepping your grounds at all when you bring some of these things up?
It doesn't matter.
Right.
It doesn't matter. My job is not to make people happy. My responsibility is to provide and make sure that my kids grow up healthy, strong, possibly happy, but I'm necessarily going to say, oh yeah, Mrs. Jones, that's great, do whatever you want. That's not what I believe my role as.
Yes, we do have problems. We're children's advocates. We have a voice for the child, and so.
It's not always what the parent wants to hear
No.
necessarily.
It's not always what they want to hear.
No.
But we have to be straightforward, and I believe we need to be straightforward and honest about that.
Yep, no question. How do you feel about natural health, naturopathy, alternative medicine, some of the newer non-traditional medicines and therapies that have come out over probably the past like at least 10 years, probably more like 20? How do you feel?
I was just going to say a couple things on that. One is, I refer people. I refer people for yoga. I refer people for hypnosis. I refer people for acupuncture. Okay, so we use different things depending on what's involved with the individual with that.
Right.
Where we draw the line is, there's certain conditions I don't treat that way. If I have a child that has leukemia and they're seeing the oncologist and say, you know, Dr. Lee, I want to go see so-and-so because he said if you do massage, it takes care of it.
Right.
That's not something we go along with.
Right.
But the other things, yeah, it's not a problem. People want, they say, you know, Dr. Lee, I want to try these vitamins and see if this works. Fine, I looked at it. I don't think it's a problem with that. You can try those and see. But then we need to reevaluate it. But that lets them make decisions and let them be involved in their child's health care. But I also like parents to know that we're not the great gods of medicine, that we have all the answers, and we open our book and we give things and everything else is bad.
Right.
You know, if someone was able to do, if someone walks out and makes a leaf collection, and that takes care of all their depression, their anxiety, I'm very happy with that.
Right.
I don't have any problem with that at all.
Right. Doctor?
Yes, I totally agree. We're partners with the parent in taking care of their health. And so if they are interested in something other than what we are providing, I will research it and look it up, you know, and make them aware that herbs, natural, are chemicals too, and they might not be safe.
Right.
But I totally believe in the exercises and the massaging and the acupunctures and some other modalities that are out there.
Just one quick one on herbs I want to mention is that sometimes I'll see some of my athletes, and they'll come in and say, oh, I'm drinking this, I'm drinking, you know, so I don't want to mention it because I don't want to get sued, but they mention these things. And a lot of them have supplements in them that are banned by the NCAA.
Right.
So if these kids are going on to college to play sports, okay, they can lose their scholarship or lose their eligibility if they ever test or anyone finds out that's the case.
Right.
So it's really, really important. It's not just, oh, they're natural, they're herbs, because every product has a little line at the bottom. This product is not intended to diagnose, treat, cure, or prevent any disease or condition.
Right.
Every one of them says that.
Do you ever have a problem with just passing people off to other providers, or referrals, or authorizations?
We do consultations. We definitely do consultations, but we are their home base. We want to know
what's going on
with that consultation. What the treatments are, what the recommendations are.
Okay, so that goes in their charge just like anything else.
Yes, yes.
It's a good thing. I mean, would you mention the medical home, because it allows you to see what's going on with the person and what's their real needs. Because if they go see one specialist, they're taking care of this one aspect maybe. They're not seeing how does that fit into the whole picture.
Right.
Whereas they come and say, okay, I really want you to see so-and-so because I know so-and-so has done really well with adolescent girls. I really want you to see this one for this, and we'll see what the case is. Or I want you to see this allergist, and we're going to do that.
Right.
it works out much, much better with people that way, because then I know what worked or didn't work, where we're going from here now. How's best to help your child?
Right.
We're usually more available for them than the specialist if they have a
Yes.
problem with their medications or whatever is going
Because you're going
on.
to see the person ongoing. The specialist might just be there for one
right,
point in
and
time.
on call when the offices are closed. So
Okay.
it is important.
Without getting too political, how do you feel? What's happened because of the healthcare reform that President Obama passed in 2009? How do you feel? How's that impacted your practice?
Personally, I think it's not going to impact the way we care for the child. It's not going to make any difference. The business unit might change, but the care of the child is going to be the same. We still take care of those that come through our offices with Medicaid and the Child Health Plus system, and so
no real change
it's not
from
going to change from my perspective.
Right.
No.
Okay.
I think that for us pediatricians, like I say, we're a different brand. We do what we need to do regardless of what we're getting paid, reimbursed, anything. We think the child needs, and that's what we do.
Right.
And it's my hope at some point in time that the politicians and the insurers will get together, and instead of trying to see which loopholes I can find on which side of the fence, okay, they can talk about it. What's the best way to further health? What's the way to take care of it? I mean, if you look at hepatitis B vaccine, why does everybody get hepatitis B vaccine? They get hepatitis B vaccine, I'll answer my own question, hepatitis B vaccine, because the insurance companies felt that if one of their kids gets hepatitis B and needs a transplant, okay, they will have saved more money by giving everybody hepatitis B vaccine in their practice, because it was not covered previously.
Right. Okay. Since the time you become a physician, I don't know how long ago it was for each one of you, but what's changed over time when you first entered the field versus today? What have you seen that stood out to you, if anything at all? Is it basically the same? How do you,
Our inpatient coverage has gone down, which is a good thing, and I give credit to that to the vaccinations, the immunizations. Our asthma kids are doing better. Yes, I think overall, since I was in training, I graduated in '96, and since then, I think inpatient rates have gone down. But then there's some other social issues that have gone up, psychological issues, unfortunately, stress and anxiety, depression, unfortunately, just so heartbreaking, suicide, those have gone up. So there is a big shift.
Prevention, is there more of a focus on prevention now than it was?
Yeah, we've always, that's what always was drilled into us from day one of residency, is prevention. So our prevention, I think now, with the gun violence and the shootings and those divorce rates and things like that, have changed. And so we're talking about different things, and with the internet and the texting and we're talking about different things.
Pediatricians have always been about prevention. One of the reasons people go into pediatrics is because you're not dealing with somebody at the end stage who has now smoked for 40 years. What are you going to do about it?
Right.
Gained weight and hasn't exercised 40 years. We're talking about what can we do now to move these kids along. The unfortunate part, I think, for us is that the people that run a lot of the shows are no longer doctors and pediatricians. And so the business aspect of pediatrics is much different.
Right.
The computers that are supposed to be saving everybody actually make a lot more work for people to do than before. And there's so much more paperwork now that people have to do. So it's a different thing. I think some people now coming out actually view pediatrics as a job, not as a career. I don't know how you feel, but for us, I believe it's like pediatrics is your life.
What you want to do, right?
I'm a pediatrician 24 hours a day.
Right.
Somebody has a problem, you see it. It's not like, 4 o'clock, I'm signing out, see you later.
Right.
We're pediatricians, 24 hours a day. And I think that some of the stresses and changes have changed a lot of that aspect. But the heart of the matter always is, what's the best way to care for children? What's the best way to make kids healthy? What's the best way to have families be strong? And that's what we always look at, and it's different. But you're right in terms of nowadays, we have so many more kids with anxiety and depression, suicidal ideation, drug usage. It's too much too soon for a lot of these kids.
Right.
Life has become too fast for them, the children.
I think at everyone, and it filters down to the children also. Okay. Is there anything you'd like to see change in the next 10, or at some point in the future? Any particular change you'd like to see happen in your field, whether it could be related to practice or something else, anything else at all? Any other changes?
Managed
Yes.
care, I think.
Managed care?
Yeah, it's, that's all these prior authorizations that we do, fighting for the kids. If they don't realize why we're recommending a certain drug or a certain therapy mode, that's frustrating.
Right.
Managed care is frustrating for us, I think.
I would like to see, just like we had a decrease in Haemophilus, a decrease going down in pneumococcus, that we have the same decrease in meningococcal disease with our college-age kids. I'd like to see us get, better vaccination status for these kids and have the incidence of those diseases go down more so than they are now.
Right.
I think that will be a good thing to do. The managed care, you're 100% right. I mean, it's a lot more business now than before with people. People just be able to, you look at the chart, you look at the kid, you decide what to do, you go off from there. Now it's like, oh, well, I got it. Oh, I got to call this. Oh, I got this insurance. Oh, he needs a pre-authorization. He can't use that medication because he has to be on this other medication for 2 weeks first. And then after that one, okay, he's got to throw up 6 more times, and then he can use this other drug like that.
Yeah.
And it's ridiculous. Or the other thing is services now. Kids are denied more and more services now because it's a good way to cut back.
Right.
Like when I first started practicing speech, I feel like speech is one of the best things you can give a kid.
Right.
You got a kid speech therapy, developmentally they do better, socially they do better, academically they clearly do better. And it used to be 50% decrease you got services. Now you have to be, I think it's like 15%
Yeah, it's
of
crazy.
normal
Yeah.
before they're going to be advocate for any services at all. It's a really hard thing.
It is.
Now more related to both of you. When you started out in your careers, why did you want to be a pediatrician? What made you, growing up, what made you pick this job versus, not job, I don't want to say it like that, but what made you pick this profession? How did you go about that? Was there one moment, or is it something that evolved?
It's just the love of the kids,
Yeah.
They just make you laugh, and it's a great joy to be around them. Just gravitate to them wherever I am.
Yeah,
It's
it's
just,
something.
they just let you play and sing, and it's just great. No matter what underlying disease they have, their outlook is
Totally
incredible.
different than adults, yeah.
Yes,
I tell people that we have the best job in the world.
you really do.
Okay, aside from being a dad, I think being a
Right.
dad's number one. But after that, being a pediatrician, I think is the best job in the world. For myself, I taught school for years before I became a pediatrician. I took night classes. I did volunteer work in the emergency room at Boston Children's for several years. I got a master's degree in psychology, and then I decided, okay, I'm going to go to medical school after doing all these things.
Right.
So I applied and got into 5 medical schools here, went, and I've always done things with kids.
Right.
And I look at it like, one thing is we talked about the good things, where we're able to try to see what can we do to help kids grow up? What can we do to help them move along? And I've been doing it long enough that I'm seeing kids of kids now.
Right.
But the other thing we do, and we do it better than anybody else, is we help parents through really traumatic, terrible, horrible times. As far as I'm concerned, there is nothing in the world worse than having a child die before their parents.
Right.
And we are one of the few groups that can't solve that. Nobody can solve that. But we can be supportive and be there for the parents and the family. And I think we do a better job at that than almost anybody else does. And I think that's a really important part. It's not just the good times, but it's when they're really sick, they're really not doing well. Tragedy strikes a family. I think that's one thing where that medical home that you brought up before, that you're that pediatrician, that people come and seek you out about that.
Right.
Yes, that's true.
Right. All right. Well, that is about our show. I think we had a really good show today. We provided a lot of good information for parents and potential parents. I want to thank both Dr. Looney and Dr. Gandham for coming in today and taking time out of your very, very busy schedules, as always. And I want to thank you for watching, and I hope you tune in next time for the next edition of Health and Wellness. And take care and have a great weekend.